Because October is Breast Cancer Awareness Month and I'm a breast cancer survivor, I have been running a series of videos about breast cancer. In this video, I'll be discussing 25 things I didn't expect to happen when I learned I had breast cancer. So if you or a loved one has been diagnosed with breast cancer and you want to learn about unexpected effects of chemotherapy, radiation, surgery, or other related breast cancer issues, please stay tuned. On September 21st, 2009, I was diagnosed with breast cancer. At the time, while I knew that many types of cancer existed, I didn't know that so many different types of breast cancer existed, nor did I know that one person could experience more than one kind of breast cancer. When I talked to one of my friends at our high school reunion, I learned that she had 4 different types of breast cancer 4 different times. I also didn't realize that not only did breast cancer come in 5 stages, 0 to 4, but also that tumors are further categorized into grades. Information about the various types, stages, and grades of breast cancer appear near the end of this video. Also, links to my other breast cancer videos and a blog I wrote describing my journey with breast cancer appear in the description below. The nurses, oncologists, and staff at the Mills Breast Cancer Clinic, where I received chemotherapy, radiation, and surgery, treated me with the utmost respect and provided me with a ton of information, way too much for me to absorb, and they held my hand throughout the entire journey. I was and still am grateful for their support. Even though I had at my disposal a library of information, I either didn't realize the severity of some of the after effects, or I didn't know how badly they would affect me. Here are the 25 things I didn't know prior to a breast cancer diagnosis. First of all, I didn't realize how apprehensive I would be, not about hearing I had breast cancer, but about wondering who to tell, when to tell, and how to tell. That was the first and the worst experience in this whole cancer ordeal. Well, one of the worst. I delve into that dilemma more deeply in my video linked below, How to Tell Loved Ones You Have Cancer. Number 2, the sentinel node biopsy was the most excruciating pain I have ever encountered in my entire life, and I've had 4 kids. I was warned it would hurt, and when one of the nurses held my hand and told me I could squeeze it as tightly as I needed to squeeze, and even though I put the recommended numbing ointment on my nipple where the needles would pierce me, I felt every pierce as if an ice pick was being thrust into my nipple. The intensity of the pain caused tears to shoot out of my eyes instantaneously. Excuse me. Because this happened 10 years ago, I hope this barbaric method of performing a sentinel node biopsy has improved. If nothing else, please sedate the patient. If I ever get cancer again and my type has a high recurrence rate, I would hope I would be unconscious if they ever have to do that again. The third thing, as far as chemo effects are concerned, you hear about side effects of chemo. But would you expect blisters on your chest? I felt as if the chemotherapy was boiling me from the inside out. What I also didn't know was that when I used the toilet, I had to cover the seat because everything that emitted from my body was toxic. And one very painful side effect of chemo were sores in my rectum that made me feel as if I must have swallowed glass shards, because I felt as if shards of glass ripped open my rectum and caused me to bleed. I dreaded going to the bathroom every time. When I told my oncologist about this problem, she nodded and with sympathy said, "I know." Number 4, the possibility of infection is high when you receive chemo. Chemo lowers your resistance. I was warned to stay away from anybody with a cold or anybody with physical illness, but unless I lived inside a glass bubble, no way was I going to avoid coming into contact with people who had colds. I listened to the advice I received, but I got pneumonia and had a severe respiratory infection anyway. Mouth sores were another warning I received, but every time I ate, I felt as if I had enormous open sores in my mouth. The pain was so awful I couldn't open my mouth wide enough to accept a spoon. My tongue felt as if when I swallowed, attached to my food were 1,000 long, sharp needles. I had difficulty speaking and I had difficulty swallowing. Number 6, I experienced extreme fatigue. And by extreme, I mean extreme. I couldn't understand how some people got up from the chemo chair and went to work. I always told everybody I felt as if I was carrying around an elephant on my back for days after a chemo treatment. Oncologists refer to chemo treatments as chemo cocktails because all cancer patients receive different kinds of concoctions. So I was happy to hear I wasn't a wimp after all. I just had a very strong cocktail, and not the good kind. Getting chemo also means the potential for heart problems. Nurses had to check my heart and blood levels every time I received chemo to make sure my heart was strong enough to receive chemo treatments. Hair loss was another thing I expected, but I didn't know that I would experience a tingling sensation and pain on my scalp just prior to significant hair loss. For some reason, I didn't think about hair on any other part of my body, but hair loss doesn't affect just the head. I lost hair everywhere, and I realized for the first time the importance of eyelashes and nose hair. My eyes teared excessively, and my nose dripped without warning. Number 9. I was aware of harmful radiation effects because I was warned about how easily my skin would burn after radiation. But what I didn't know was that 95% of the sun's rays filter through clothing. And unless I washed my clothes in a special detergent that offered UV sun protection, I could burn my skin even if I was wearing long sleeves and pants and sunscreen. I was told to stay out of the sun for an entire year after radiation. Focusing or memory loss is another side effect of chemotherapy. A lot of people complain of what they refer to as chemo brain. For me, that wasn't a problem. Apparently, I've been preparing for these moments all my life because I've always been a little bit foggy. I couldn't tell the difference, but I was forewarned, and I don't know if any of my family members noticed. Unforeseen problems prior to surgery could prevent someone from getting surgery. If some of my blood levels were too low, I wouldn't have been able to have the surgery. I've always had a problem with low potassium, and I had to increase my potassium intake before I could get surgery. Surgery is another complicated process because it isn't a matter of just removing the tumor. I learned the importance of good margins. Surgeons don't remove just the tumor. They must remove an area around the tumor too, which they call margins, and they look for good margins. Because my tumor was so close to the chest wall and breastbone, I was told that I might possibly lose a portion of my lung, which was scary for me because of my history with asthma and respiratory issues. Fortunately, my pulmonologist told me that I could lose up to a third of my lung and I would still be fine. I was hoping I wouldn't have to worry about that, but I was prepared for the worst possible scenario. Plastic surgery was an option I was given in addition to general surgery. I declined because I didn't want to go through surgery twice. What I discovered, though, was that what the surgeon was trying to tell me was that the type of surgery he would perform compared to what a plastic surgeon would do was the difference between a wrecking crew and a decorating service. I now have a deformed breast. Scarring didn't bother me until I learned that scar tissue grows. I didn't know that. And it continues to cause long-term, sometimes intensive pain that changes over the years and limits movement. The pain for me, because the surgery took place so close to the breastbone and chest wall, when I move in certain ways, even now, and I never know which way that will cause the most pain, I experience crushing and excruciating pain. I'll have to learn to live with this kind of pain as the scar tissue continues to grow, but it's really hard to figure out how to move to avoid it. Limited movement after surgery meant I couldn't lift my arm high enough to get anything out of a cabinet. Every day I pushed myself a little harder, but not enough to cause intense pain, and thanks to my persistence, I have been able to use my arm as well as I could before surgery. Lymphedema, which is swelling in the arms or legs, occur once lymph nodes are removed. I learned that I had to wear a compression sleeve when I flew to prevent my arm from permanently swelling. And I couldn't get my blood drawn or my blood pressure taken on that side of my body because of the possibility of lymphedema. Another surprising side effect of having your lymphs removed is that I couldn't get deep tissue massage on that side of my body. Numbness was another complication with lymph node removal. I still, nearly 10 years after surgery, have no feeling in the area where the lymph nodes were removed from under my arm. The numbness is a concern for me because if I get stung because of my allergy to bee stings, I won't know until probably too late. Osteoporosis was another possible side effect of chemo and radiation. I was diagnosed with osteoporosis a few years ago, but I get a reclast infusion once a year to prevent it from getting worse, and I take glucosamine chondroitin. I don't know if the reclast alone helped or if the combination of reclast and glucosamine chondroitin helped, but osteoporosis, that's a hard word apparently for me to say. Osteoporosis in one of my hips actually improved and is now considered to be osteopenia. Nausea and vomiting are common side effects of chemo treatments. I never experienced vomiting, but I did experience nausea. So often I had no appetite. Visual disturbances can be another side effect of cancer treatment. My eyes changed a lot during that time, and I needed to change my prescription. More common side effects that I never experienced, but that others receiving chemo treatment have experienced, are nail changes, which one of my online friends experienced, weight changes, vaginal dryness, anemia, and diarrhea. And now, for information I promised at the beginning of this video, here are the types of breast cancer, the stages of breast cancer, the TNM system, and the G system, the grade system.